But in the meantime, we've got Brandon Reynolds joining us from OrthoVirginia as we start every Wednesday morning, having someone stop by from OrthoVirginia. Brandon, thank you so much for taking some time, a physical therapist with OrthoVirginia. How is your Wednesday morning starting out?
Thanks for having me. It's going pretty good so far. Still a little early.
Yeah, it's still a little early. That is very true. I want to know, first off, how'd you get into physical therapy? When did you decide that was what you wanted to get into?
I didn't actually get into thinking about physical therapy until I was actually out of high school. I expected to go into some type of like architecture engineering, and then I started working in a supplement shop, and I was really into exercising, working out, and I kind of changed my pathway because I really enjoyed helping people, and I enjoyed working out. So I was trying to find a good blend between how can I help people do things that they want to be able to do, but also kind of incorporate that exercise into it. And I kind of stumbled upon physical therapy, and I was like, this is the perfect blend. And so far it's been everything and more.
What are some common misconceptions about physical therapy? My mom owned a physical therapy clinic in Louisa for a number of years, and it was always listening to her talk about how all of these misconceptions about physical therapy and how important it actually is. So I'd love to hear from your perspective, Brandon. What are some common misconceptions about physical therapy?
I think the big misconception is always like PT stands for pain and torture. That's a big one we always hear. And I think that's honestly actually like the opposite of what we do. Our main goal is not to, torture you or put you in pain. Our main goal is to get you out of that pain, get you back into doing functional activities and doing the things that you enjoy doing. So I think that a lot of people hear that and are scared or apprehensive and expect to be coming out with more pain or maybe a little skeptical and want that quick fix, where we try to provide a fix that's maybe take a little longer, but ideally we can get you feeling better relatively quickly, but then it lasts for a long time to decrease the risk for having to take medications or surgeries down the road.
Yeah, I mean, as someone who had to go through physical therapy for like a number of weeks for my pinky of all things, the pinky was rough, but it was like after finishing a workout, like the good pain after a workout where you feel like I went from not having any mobility in my pinky after a pinky surgery to now having full mobility back because of what happened at physical therapy. But it's funny. Who knew a pinky would cause that much work with physical therapy? It was insane.
Yeah, very true.
Brandon, what's your role with athletes? And as a reminder, we'll talk about some injuries, things like that around sports. You aren't treating these athletes, but just sharing your expertise. What is your role with athletes specifically to get them back onto the field following an injury or potentially following a surgery?
Yeah, so I think the first step with athletes especially, but this kind of works for the majority of the population, is trying to figure out why we had this injury. Was it a non-contact injury? Was it a contact injury where there's some muscular imbalances, some mobility issues? So we're not just treating the diagnoses or the injury itself. We're trying to find different impairments that we find throughout. So, did we pull that hamstring because we have lack of mobility somewhere else up the chain, whether it's, at the hip or down at the foot, or maybe up in the back area. So we're trying to assess why things are happening so they don't happen again. But then we're also trying to quiet the tissues down a little bit. So you come off, say, like an acute ankle injury or hamstring injury. We're trying to basically decrease the pain, decrease the inflammation in a safe manner, and then kind of, as we're assessing things, working on strengthening the things that need to be strengthened, improve the flexibility of the range of motions of the things that need to be worked on, but then also working on, motor control as far as trying to get balance, proprioception. So we're reducing the risk for re-injury, because that's the big thing. An injury, can take us out for days, weeks, but the more often it happens, the more a high likelihood that there's going to be another injury. And we want to reduce that risk as much as possible.
Brandon Reynolds, a physical therapist for OrthoVirginia, joining us this Wednesday morning. I'm curious, what's the most difficult injury that you typically see to come back from in an athlete, but also in like a normal person? Because I know it's kind of different between the two types of people.
Yeah, it's different because there's different demands placed on the body. I think, one that's always kind of brought up, maybe not, and it's not necessarily surgical, but usually hamstring. We have Emeka Ibuka that just had a hamstring injury. And there's different grades to, hamstring injuries, whether they're strains, tears. But that one's kind of tough to come back because the injury is usually because it's basically the main goal or purpose of the hamstring. One of them is to slow down the lower part of the leg as it's accelerating through space. So it's basically doing its motion while it's elongating or, stretching. So it puts a lot of stress on the muscle. And as we're walking, running, cutting, it's just a constant, we're constantly aggravating that tissue if it's angry. So it takes some time to calm that down. And then, of course, you have athletes that, you want to get back on the field as fast as possible. And it takes time for tissues to heal, whether it's, grade 1 sprain, strain, or, if it's a tear. And I would say that hamstring's probably the most finicky one because, you feel good and then you get on the field and then all of a sudden it's like, yeah, that doesn't feel good anymore. High ankle sprain's another one like CeeDee Lamb, where he tried getting back out on the field because he's like, oh, I got this. He ran one route and then sat himself out and he's been out for 3 weeks now.
Yeah.
And I would say with the general population, I think it's not necessarily the hardest, but I think it's the most prevalent is just, chronic back pain, just from, sedentary lives, sitting on computers, working long hours. It just becomes a vicious cycle. And I think that's one of the ones that we can usually nip it in the bud pretty quickly, but at the same time, it does take effort and time for the general population to, work on it. But we see a lot of good results as we're changing our movement patterns and kind of getting a little bit more active.
Brandon, you brought up Ibuka with his hamstring injury. It hasn't been released, whether it's a strain, whether it's a tear, the severity of it. But if I'm a fantasy football owner of Emeka Ibuka, right, and I see hamstring injury, and then maybe tomorrow they say hamstring strain, how happy should I be that it's not a hamstring tear?
Oh, I mean, you'd be elated. That's the difference from, maybe potentially put him on the bench just for the week or so, just to see how he's doing. Compared to putting him on IR. And then, if it's a tear, there's an increased likelihood for re-injury down the road. He's relatively young, so that's pretty good, but still there's that any type of higher grade tear compared to a strain is going to be more, going to be out for a little bit longer. So we're hoping for the best, all fantasy owners, and just in general football lovers. And, we don't want anyone to get injured. So hopefully it's, low grade, if anything, and he'll be back on the field shortly.
And I do, as a reminder, as we talk about injuries around the NFL, you aren't working directly with them, just sharing your expertise. And with that, I want to ask about high ankle sprains versus low ankle sprains, because you hear high ankle sprain all the time, and you think high ankle sprain is actually a lot worse than a low ankle sprain, but that's actually not the case all the time, right? It's not high and low in case of severity. It's where it occurs. Is that correct?
Yeah, that's correct. So high ankle sprain is usually a little bit above the ankle joint itself, usually between like the lower portions of the tibia and the fibula, which is basically the two lower bones in the leg, and the tissues kind of surrounding that. So there are two different injuries. You could have a high grade low ankle, and that could be more severe than a low grade high ankle sprain. But it usually impacts like the stability of the ankle itself, and takes a little bit longer just because the tissues around that aren't necessarily as stable compared to that low ankle. But it really just depends on the mechanism of injury. There are, in reality, as we're treating, like you don't necessarily treat the diagnosis, you're treating the impairment. So if someone comes in with a high ankle sprain compared to a low ankle sprain, we're not saying, oh, this is high ankle, so we're doing this, or this is a low and we're doing this. It's more of what's going on with the person, because people aren't coming in as a diagnosis or as an issue. They're coming in as a person with pains, impairments as far as strength, range of motion deficits, difficulty walking. So we're seeing people, it's like, oh, their ankle's unstable when they're trying to stand on one leg, or they're having difficulty walking, or they can't, hold strength against us pushing on them. So we kind of work on the impairments, and usually high ankle sprains take a little bit longer, but it just varies dependent on person. But yeah, so there's, when we see high ankle, usually you're expecting them to be out a little longer, but it doesn't necessarily, it's not always the case.
Gotcha. That makes a lot of sense. Is it possible to avoid surgery through physical therapy? Like, is that something some athletes do? Like, I know Terry McLaurin's going out and he's trying to find all of these second, third, fourth, fifth opinions on his, I think, quadricep injury. Is he doing that to try and avoid surgery and maybe work through physical therapy to avoid that?
Yeah, so I can't speak exactly for him, but in general, we try to go the more conservative routes before we go into surgery. Obviously, there are certain times where surgery is necessary, and that's cut dry, let's go. But there are cases where we have ACL injuries where people opt not have ACL reconstructions because there is some newer evidence that's coming to light that the ACL can somewhat heal on its own. Takes a little bit longer. And that's kind of newer research, but it may not be necessarily, it won't get you back on the field fast, that the ACLs, like, they're still getting them back pretty fast, and we'll kind of leave it at that. But, we're looking at 9 months, 12 months plus. Whereas if you go the conservative route, say with a tear or something like that, it might take a little bit longer. But other avenues such as strains, low-grade tears, just generalized pain as well can definitely be worked on with physical therapy before surgery. And it's usually advised because with physical therapy, say if you're having, and we call it prehab, you're getting PT before potential surgery, you're going to get more range of motion, more strength. You're going to get a better feel for the PT, because a lot of times you get surgery and you see the PT day one or something, and you're like, who is this person pushing my leg? But you can build that rapport, which is a huge benefit. So getting PT before any type of surgery, or even going down that route, could potentially decrease the likelihood of having surgery or have a better prognosis afterwards.
Huh, that's interesting. I never knew that was a route. I haven't had too many surgeries, thankfully, knock on whatever wood is around me. But that's really interesting to know. And then kind of on a macro level, overall, how does physical therapy help restore a patient's strength, flexibility, and mobility? How does physical therapy help with that?
Right. So physical therapy is a very multimodal approach. So we have our hands-on, which, either people love or people hate, but, we have our joint mobilization, soft tissue kind of massage. We have dry needling, which can kind of help with some muscular tone. We have cupping, taping. So we have a lot of different hands-on approaches that can kind of help. But then we also have the isolated exercises to work on strengthening, elongating the muscle or improving range of motion, improving joint mobility. But then we have more of the functional exercises too. So, if you want, say if you want to be able to lift your grandchild when you're, older, and you're having, say, either a back issue or a shoulder issue, like just raising your arm up in the air isn't going to do much. But if you're able to do exercises that might mimic or, mimic picking up your grandchild. So, either doing like a squat or like some type of lift, that's going to carry over a lot better functionally. So a lot of times with PT, we're trying to give isolated and functional movements because we want to get people back to doing the things they love. And that's, doing, whether it's sport, whether it's weekend warrior, whether it's playing with your grandkids. So we're trying to give a lot of different exercises, interventions to kind of address that.
Awesome. Brandon, thank you so much for your time. If people want to learn more or schedule a physical therapy appointment with you guys at OrthoVirginia, how can they do that?
Yeah. So first, like if you're going into any like OrthoVirginia like center to see a doctor, either it's an on-call or it's like a surgical suite or follow-up thing like that, you can always chat with them and they can get you established with a scheduler, or you can call 804-486-6910. And that's going to be like the centralized calling center.
Awesome. Brandon, thank you so much for your time. Really amazing insights. Hopefully you're not an Emeka Ibuka fantasy owner and you're not having to worry about his hamstring strains. But regardless, I imagine having the physical therapy background can kind of help you kind of suss out some of the injury news that comes out. But appreciate your time on this Wednesday morning. Have a great rest of your day.
Thank you.